Let me start with something that surprises many people the first time they hear it. After 70, the biggest health risk isn't always missing a disease. Sometimes the bigger risk is finding something that never would have harmed you, and then getting pulled into a chain of follow-up tests, procedures, and medications that reduce your quality of life. And I'm not saying this as an anti-doctor message. I'm saying it as someone who has watched this pattern play out again and again. A well-meaning test leads to an uncertain result. Uncertainty leads to more testing. And suddenly, a healthy older adult is living inside a medical pipeline they didn't truly need. In fact, large reviews of low-value care have repeatedly shown how common unnecessary testing can be, and how often it leads to downstream procedures that create real harm. So today, I'm going to talk you through 5 checkups that many people over 70 get automatically, even when they feel fine, where the potential harms can quietly outweigh the benefits. And I'll do something most people don't do. For each one, I'll give you a simple replacement question to ask your doctor, so you don't feel like you're refusing care. You're simply choosing better care. Stay with me, because the #1 checkup is the one that looks like the most advanced prevention, but can create the most unnecessary follow-up in older adults, often without proven benefit for people who don't have symptoms. Before we start, type your age and where you're watching from in the comments, and tell me one thing. Have you ever had a test that led to more stress than clarity? Fumoato. All right, let's begin. Number 5, routine cervical screening after you've already aged out. This one doesn't apply to everyone, but for many women over 70, it's still happening. Continued Pap tests, or routine cervical screening, even after the age when major guidelines advise stopping, as long as you had adequate prior screening and you're not high risk. Here's the hidden issue. After 70, the goal isn't more tests. The goal is the right test, at the right time, for the right person. When someone continues screening long after they've already met the criteria to stop, the likelihood of false alarms rises. Abnormal results, repeat visits, biopsies, colposcopies, procedures that can be uncomfortable, anxiety-provoking, and often end up showing nothing dangerous. Now, I need to be fair and clear. There's active discussion in research circles about whether some older women, especially those who were never screened consistently earlier in life, may still benefit from screening. But the key point is this: it's not automatic, and it should be individualized based on your prior screening history and risk factors. A simple example: I once met a woman in her early 70s who had been getting the same tests because that's what we always do. She hadn't had an abnormal result in decades. Then one year, she had a borderline result, and suddenly she was back and forth to appointments, losing sleep, worried she had cancer. The follow-up showed nothing serious, but the stress was real, and it was avoidable. What to ask instead? Based on my history, do I still meet criteria to continue screening, or have I already graduated out of this test? That's not refusing care. That's asking for evidence-based care. Number 4, thyroid screening for people with no symptoms. This is one of the most misunderstood areas of modern medicine. Many older adults end up getting thyroid ultrasounds or imaging of the neck for vague symptoms, or sometimes just because a doctor felt something mildly uneven. And then a tiny nodule shows up. Here's what the science has shown for years. Thyroid nodules are extremely common, especially as we age, and most of them never become dangerous. The concern is that screening asymptomatic adults can lead to overdiagnosis, detecting cancers so slow-growing that they would never have caused harm in a person's lifetime, and overtreatment can cause real complications. That's why the U.S. Preventive Services Task Force recommends against screening for thyroid cancer in asymptomatic adults. And this matters after 70 because thyroid surgery isn't nothing. It can lead to voice changes, calcium problems, lifelong thyroid hormone replacement, and complications that affect swallowing and quality of life. What to ask instead? Do I have symptoms or risk factors that make thyroid imaging necessary, or are we likely to find an incidental nodule that won't change my outcome? That one question protects you from a lot of unnecessary stress. Number 3, carotid artery ultrasound screening. When you've had no stroke symptoms, this is a big one. Many seniors are offered a carotid ultrasound, sometimes at clinics, sometimes through screening events, sometimes even as an add-on to a checkup, just to see if there's narrowing in the neck arteries. It sounds logical. Find narrowing early, prevent stroke. But here's the issue. In people with no symptoms, the screening often creates false positives, unnecessary follow-up testing, and sometimes procedures that carry their own stroke and bleeding risks. That's why the USPSTF recommends against screening for asymptomatic carotid artery stenosis in adults without a history of stroke or transient ischemic attack symptoms. After 70, this matters even more because the cost of one finding leading to the next can be higher. More consults, more imaging, more anxiety, and sometimes an intervention that was never needed. What to ask instead? Am I having any symptoms that would justify this test, or are we using it as a screening tool? And if it's screening, ask the smarter follow-up question. What's the plan if we find mild narrowing? Because if the plan is simply more scans and worry, that's not prevention. That's surveillance. Number 2, routine. ECG, or stress ECG. In low-risk people who feel fine. This one is extremely common. An annual ECG, just to be safe, or an exercise stress test because you're older, even if you don't have classic symptoms. The problem is that heart tests have a known issue. False positives can lead to additional tests, and those can expose you to contrast dyes, radiation, and invasive procedures that carry real risk, especially in older adults. The USPSTF has recommendations that push back against routine ECG screening in asymptomatic low-risk people, and major medical groups have also discouraged routine screening ECGS for low-risk patients. The key is not never test the heart. The key is test with purpose. If someone has chest pain on exertion, shortness of breath, fainting, or a major change in exercise tolerance, that's different. That's a clinical reason. But routine ECG screening can create a scary label, abnormal, even when the finding is minor or age-related, and then the cascade starts. What to ask instead? What symptom or risk factor are we investigating with this test, and how would the result change our plan? If the result won't change the plan, you're not doing prevention, you're doing paperwork. Before we go to number 1, quick reminder, if you want more videos that help you stay healthy, without getting pulled into unnecessary procedures, like the video and subscribe, because this information can genuinely help other seniors make calmer, smarter decisions. Now, the one that looks like the most high-tech prevention. Number 1, whole body scans for peace of mind when you have no symptoms. This is the one I want you to hear clearly. Whole body CT scans are sometimes sold as the ultimate preventive checkup, especially in private clinics and executive screening packages. But major policies and radiology guidance have consistently warned that whole-body CT screening in asymptomatic people has no proven benefit and carries meaningful risk, radiation exposure, and a high likelihood of incidental findings that trigger biopsies and unnecessary procedures. And after 70, incidental findings are common. Small cysts, tiny nodules, harmless calcifications, things that may never cause a single symptom. But once seen, they create a psychological trap. We found something. Now, we have to chase it. That chase can include repeat CT scans, PET scans, needle biopsies, and surgeries. And sometimes the complication from the procedure becomes the real health problem. This is why many experts emphasize targeted imaging. If you have a specific symptom, unexplained weight loss, coughing blood, a new lump, severe persistent pain, then imaging can be life-saving. But scanning everything just to look is not modern prevention. It's fishing with a very expensive net in water full of harmless shadows. What to ask instead? What symptom are we trying to explain? And what decision will this scan change? And if you're doing it just to be safe, ask the final question. What are the odds this scan helps me versus the odds it leads to follow-up procedures that don't improve my lifespan or quality of life? That question alone has saved many people from unnecessary cascades. The real takeaway, if there's one idea I want you to keep, it's this. After 70, better health often comes from better targeting, not more testing. There is a huge difference between a test that answers a real clinical question and a test that creates new questions you never needed. So here's your rule you can use at every appointment. Always ask, what happens next if this is positive? And then ask, what happens next if it's unclear? If the honest answer is more testing, more worry, and likely no change in outcome, it's completely reasonable to pause. Now I want to hear from you. Which of these have you been offered? Or which one surprised you the most? And what test have you done in the past that you now feel was unnecessary? Share your experience in the comments. Your story can protect someone else. Thanks for watching.